we're continuing to look at veteran-focused services that the VA has to offer, and we turn now to the mental health services provided to our veterans. Angela Hahn-Mowry is the Chief of Mental Health Services at the James E. Van Zandt VA Medical Center. Welcome. It's good to have you here.
Thank you for having me.
This is a really important topic, so I'm glad we're going to take some time to talk about it. There's discussion nowadays about the importance of mental health services at long last. Why is addressing mental health services and mental health disorders so important?
Well, no one should be suffering, especially our nation's heroes. So we're trying to get the word out to let everyone know about the amazing mental health services that we have at the Altoona VA. We want to just let everybody be aware of what we have to offer and that veterans can seek care, because we know that when veterans go into the service, they're really told to withhold all of those emotions. They're not allowed really to express them because they're focusing on defending our country. So we want them to be we want them to express themselves and come in and seek care if their emotions, behaviors, or thoughts are negatively impacting their life.
It's really key what you just said about our veterans. They're so stoic. They don't want to talk about these things, and we understand that. It's part of their training, but mental health disorders are real, and maybe some of them need to understand what mental health disorders are and when does a person seek care for them. So maybe you can illuminate us more on that.
Sure. So all of us have some sort of mental health concern throughout our life. And a mental health concern is maybe a loss or a situation that you didn't handle real well. But typically most people get over that over a certain amount of time. They have internal coping mechanisms. But when it becomes an illness is when it's causing you increased stress and you're not able to function. So if you're not able to really get through your daily life, and it's causing you increased stress, then you really need to be seeking mental health care.
I couldn't agree more. And yet there's a resistance. So what do we say to our veterans to encourage them to come see somebody like you with your expertise?
I think the most important thing is that recovery is possible. There's a stigma associated with mental health care that veterans don't want to come in because they're afraid, like, I might look weak. Actually, when you identify a problem, whether it's medical or psychiatric, it actually demonstrates strength. So that's why we've tailored a no wrong door approach to the care that we have at the Altoona VA. So a veteran can present to any of our CBOCs or even our Altoona clinic and be seen that same day by a mental health professional.
How did you say that? No wrong door?
No wrong door approach, yes.
I love that so much. It just feels like doors that can open for you. It's
Absolutely.
Something so positive.
Absolutely.
What might an evaluation look like for a veteran?
So what it looks like when they walk in, typically we'll have, if they present to just a clinic independently, then typically we'll have them meet a registered nurse to do a quick triage and then a warm handoff to a mental health professional. But what we do differently is that we provide comprehensive wraparound care. So what does that look like? That is a team of mental health professionals that are wrapping around that veteran to coordinate their care, to provide veteran-centric care, and to really show them the buffet of mental health services that we have to offer. Our traditional outpatient mental health services are medication management and numerous psychotherapies that are symptom driven. So if you have depression, we have numerous therapies for depression. If you have anxiety or insomnia, and they're all tailored to what the veteran needs.
I just can't tell you how much I love that wraparound scenario, that ability to really get to know a veteran and what he or she needs to be well again. Any final words to encourage veterans to get a checkup?
That we're really here to help. Like, please come in, let us engage you into care and show you what we have to offer, because we are here to really help and to provide the support to our nation's heroes.
You are our heroes. You are brave beyond words. You signed up to take one of the most difficult jobs. So just be brave about this too.
Absolutely.
Thank you so much. Thank you for the great work you're doing for our veterans.
Thank you.
We'll be back with more on Fox 8 News Now.